Are you afraid of tearing during birth? One of the biggest fears I hear voiced in my childbirth classes is the fear of tearing during childbirth. This is a big topic, and I'm just going to deal with some of the important points. While first-degree tears are common, heal quickly, and often don't even require stitches, third and fourth-degree tears are much more serious. There are several factors that can increase the likelihood of tearing: the size and position of the baby, a birth facilitated by forceps or vacuum, the position in which you give birth, particularly lying on your back or even semi-sitting, a baby that's coming out very fast, and directed pushing, meaning that the care provider is telling you how to push as opposed to you listening to your body's cues. However, according to research, the biggest risk factor for a serious tear is an episiotomy. An episiotomy is the surgical cut to widen the opening of the vagina. While the birth attendant, doctor or midwife, might feel that it's preferable to do a controlled cut rather than risk an uncontrolled tear, research doesn't support this practice, and an episiotomy can tear further. Plus, a tear might be very superficial, while an episiotomy is a surgical cut through all the muscle layers. According to research, the most valid reason for an episiotomy is the health of the baby, as it shortens the pushing stage. So what can you do to avoid tearing when you give birth? If you plan to give birth at a hospital, find out not only their episiotomy rate, but also their rate of third and fourth degree tears. If you're hiring a doctor privately, you should also ask this question, as who is with you and where you give birth are the most important factors to consider if you want to avoid a serious tear. Some interventions used during labor, for example, an epidural that is still active during the pushing stage of labor, might make it necessary for you to be on your back or semi-sitting, and the care provider will often use directed pushing as you won't feel the contractions or how to push. Being in a more upright position means that gravity is helping to bring the baby down, and you won't have to add extra pressure on your pelvic floor and can gently breathe the baby down and out. Depending on the type of epidural given, it's possible to use assisted upright positions that can be very effective. If you want to learn how to avoid a serious tear, how to support physiological birth, and how to keep labor and birth as normal as possible, even if you decide to have an epidural, comment birth below, and I'll send you more information about my upcoming courses, both in person and hybrid.